Good afternoon, everyone. Welcome to the 2020 Hot Topics in Environmental Law Summer Lecture Series, brought to you by the Environmental Law Center here at Vermont Law School. I'm Jenny Rushlow, Director of the Environmental Law Center and Associate Dean for Environmental Programs. I'm going to bring up a list of resources on the screen to direct you to some of the programs at Vermont Law School's Environmental Law Center for those of you who are looking to learn more about what we do. And you can also view our full Hot Topics lineup by going to the website vermontlaw.edu/hot-topics. Each talk is worth 1 Vermont CLE credit. So if you're an attorney looking to get continuing legal education credit, please keep track of the talks that you're attending for your records. We will have quite a bit of time for discussion after our talk today for questions and answers. So please do type your questions in the chat box at any point during the lecture, and we will get to as many of them as we can. Today, we are very pleased to welcome Vernice Miller-Travis. Bernice is one of the nation's leading experts, pioneers, and most respected thought leaders on environmental justice, a deeply skilled practitioner in multicultural engagement and organizational development with significant expertise in clean air and water, regulatory systems, and environmental and urban planning. She is the Executive Vice President of Metropolitan Group, where she consults for federal and state agencies, foundations, and nonprofits. Prior to becoming a consultant, she established the Environmental Justice Program for NRDC and initiated the Environmental Justice Grant-Making Portfolio for the Ford Foundation. Bernice is the co-founder of We Act for Environmental Justice, a renowned environmental justice organization in Harlem, and serves on its board. She was recently awarded the Robert Bullard Environmental Justice Award from the Sierra Club, which recognizes individuals who have done outstanding work in the area of environmental justice. Bernice has served on the EPA National Environmental Justice Advisory Council and has served on numerous state and federal environmental advisory councils, including the President's Council on Sustainable Development, where she chaired the Environmental Justice Committee. She is a prolific author and frequent speaker at conferences and convenings, and is often interviewed by the media related to issues of environmental justice. Today, Vernice's talk is entitled, and my computer is freezing, so I hope that you can still see me. Today, her talk is titled COVID in the Context of Systemic Race Discrimination and Environmental Justice, and we're so delighted to welcome Vernice Miller-Travis. Take it away, Vernice.
Thank you so much, Jenny. And I know there is a delay, so I'm going to try not to talk over myself or Jenny. So I'm sorry for being a little late. I was on a call with folks in Kenya and in the US talking about race and racism in trying to facilitate a dialogue for another national or global environmental organization. It's a hot topic these days, as I'm sure you all are feeling and seeing in your own communities, in your own lives, on national and international media. There's a lot going on. But before we got to this moment of national and global recognition of the racist violence that African Americans and people of African descent have been experiencing, we were in the midst of another pandemic. And I would introduce to you a word that I was just exposed to for the first time about 3 weeks or a month ago. And I think it is a word that really speaks to this moment that we're in, particularly where COVID and the coronavirus is concerned. And that is the word syndemic, SYNDEMIC. And a syndemic is where 2 or more forces, health issues and or other forces target a particular population all at once. And so when the COVID pandemic became such a a terrifying issue for communities across the United States. I began as previously in another life as a researcher. I began to want to find out what were the demographics of the pandemic. And at first it was really hard to be able to get data and information from the CDC and from other sources about how different populations were within the United States and around the world were experiencing this pandemic. And it became such a problem trying to get this data from the CDC that the Congressional Black Caucus, the NAACP, the Hispanic Caucus in Congress began to really press the CDC, the Centers for Disease Control, about how is the pandemic affecting different populations. And slowly, the CDC began to release some information. And when they began to release this disaggregated data, that is data that pulls apart how different populations, different ethnicities, different races, different genders, how are they being affected by the pandemic, by this disease? What we quickly began to see once the CDC began to release information is that African Americans, indigenous people, Latino populations, Latinx populations were experiencing a pandemic within a pandemic. That is, we were acquiring the disease at a much higher rate than were whites, and we were dying from the disease at a far greater rate than were whites, far greater than our numbers in the population would suggest that would be normative in any kind of health crisis, but really far exceeding that. And so for me, as someone who works at the intersection of environment and race and public health and land use, those are the lenses through which I've looked at these issues and addressed these issues and worked in the space at the intersectionality of those things. I was at first, I was baffled. I was utterly baffled. What is going on? And what is making these populations so susceptible, so much more susceptible than any other sector of the population? What is happening in our communities? And I was pulling my hair out, trying to figure out what is going on. What is at the basis of this disproportionality in terms of incidence of the virus and death from the virus? And nothing was coming to the surface as I was looking here, looking there. And then a study came out in April from the Harvard School of Public Health. And the study said that one of the correlations that they were seeing was a correlation between exposure to particulate pollution, particularly fine particle pollution, 2.5 microns in diameter, and likelihood of developing COVID and likelihood of dying from COVID. And so the study said that if you lived in a county that experienced at least a 15% increase in the rate of particulate pollution, that people in your county were more likely to develop COVID and more likely to die from it. And so immediately, I thought, okay, now we're finally getting to some data that makes a little sense, that I can begin to formulate a hypothesis about what's going on. And based on my own experience and knowledge in the field of environmental justice, and particularly the field of exposure to air pollution, disproportionate exposure to air pollution by people of color, that we now may finally be getting to a place where we might understand what's going on. And so one thing that I know, because I've worked in this space for a very long time, is that many communities of color, most communities of color, no matter how remote those communities are, including Aleutian villages in the Aleutian Islands in the Arctic Circle, experience disproportionate exposure to air pollution and pollutants that travel through the air. And so we know that this has been a battle that's been ongoing in the environmental justice space for a very long time, and in a discourse with US EPA and state environmental regulators, as well as industry, particularly those who produce large amounts of air pollution, ambient air pollution, that communities of color have been and continue to be exposed to higher rates of air pollution of multiple kinds, but particularly particulate pollution. So I'll give you one anecdote to help you understand why this issue is so important to me. So it was mentioned in my bio that I'm the co-founder of an organization called We Act for Environmental Justice. I should let you know that your professor, Marian Edelman-Lago, also serves on the board of that organization. Early on, when we were first becoming aware of the preponderance of sources of air pollution in our community in northern Manhattan. So West Harlem is the west side of the Upper West Side, the way Upper West Side of Manhattan, not the most upper part, but almost the northernmost tip of Manhattan. And if you're familiar with the area where Columbia University is, it is that community plus the community that's just to the north of it, abutting the Hudson River. So from roughly St. Nicholas Avenue all the way over to Riverside Drive, from roughly 96th Street, some people say 106th Street, but all the way up to 155th Street, that neighborhood in Manhattan. We started our work for We Act for Environmental Justice by fighting with the City of New York, with US EPA Region 2, and with the New York State Department of Environmental Conservation over their plans to build the North River Sewage Treatment Plant on the western edge of our community at the river's edge, at the Hudson River's edge. That fight would go on for a very long time, resulting in litigation that we filed along with the Natural Resources Defense Council against the City of New York. We prevailed in that lawsuit in 1994, but from the time that the sewage treatment plant began operating in 1986 until the time that we filed that lawsuit in 1994, our community was exposed to the horrific odor of 180 million gallons of raw sewage every day, settling over our community, because that's what the plant was designed to do, was to treat all the wastewater and raw sewage on the entire west side of Manhattan that would be processed in that sewage treatment plant, treated in that sewage treatment plant, and then the effluent would be let back into the Hudson River. Prior to the time that the sewage treatment plant went online, almost all the wastewater and raw sewage that was produced on the west side of Manhattan would go directly through sewer outfalls into the Hudson River. So the point of a sewage treatment plant and the point of the North River Sewage Treatment Plant was to help the City of New York become in compliance with the provisions of the Clean Water Act that say you cannot just dump raw sewage into navigable wastewater, into navigable waters, any waters really, streams, creeks, brooks, but you cannot just dump raw sewage into those bodies of water, which the City of New York had been doing from the time of its founding until the time that the North River Sewage Treatment Plant went online in 1986. So there was a real environmental emergency that the sewage treatment plant was designed to address. But the one thing that they left out in the design, the engineering and design of that sewage treatment plant, was to put in place any odor control systems that would protect the 100,000 people who lived immediately adjacent to the plant from being exposed to the smell of raw sewage that was escaping from the plant every day. It was so, the plant is so huge and had such an impact on our local environment that it created a microclimate. So we had fog almost all the time, 12 months a year. We had an increase in rodent population, and we had an increase in mosquito infestation, which we had 12 months a year. The rest of Manhattan didn't have that. We had that. That's how enormous the sewage treatment plant was, and how massive were the environmental impacts of that plant on our lives. So we came together to battle with the city of New York, the state of New York, the Environmental Protection Agency, about their need to take seriously the quality of life of the people who lived across the street and nearby this plant. And what were they going to do to fix that problem? Because surely they did not mean for us to live like that for the rest of our lives. Well, actually, they did mean that. And we had to intervene to make sure that it didn't happen. In the course of engaging in that work and learning more about the processes of a sewage treatment plant, I and the founders of the organization became absolute experts on everything you needed or wanted to know or didn't want to know about the operations of a sewage treatment plant, how it functioned, how it's supposed to function, how it should operate, if it's operating at its optimum capacity or optimum operations, and what kind of a facility and neighbor it should be. So we dug in, and in so doing, we began to recognize that there were a number of sources of ambient air pollution in our community. I had a colleague in college, Dr. John Ford. He was 3 classes ahead of me, but we were good friends. And when he graduated from college, he went on to the College of Physicians and Surgeons at Columbia University to receive his medical degree. And then he became a doctor in the pulmonary medicine clinic at Harlem Hospital. Harlem Hospital is a very large municipal hospital that serves the greater Harlem community. I was born in that hospital. Both of my parents worked at that hospital. My mother was a nurse there, a pediatric nurse for 43 years. And my father was an administrator at the hospital for 36 years. So when John went to Harlem Hospital to work in a pulmonary medicine clinic, I reached out to him as soon as this problem with the sewage treatment plant became a major issue for us. I reached out to John and I said, since you deal with issues of lung function and lung capacity, I'm wondering if you can help us get our arms around what is going on with air quality in our community. And so I should back up and say that we held a number of public meetings in our community over a period of 10 years. But for the first 4 years that we were organizing in the community, we held these meetings jointly with the New York State Department of Environmental Conservation and the New York City Department of Environmental Protection. And the 4th Wednesday of every month, we would have these public meetings. And to the person, every person who stepped to the microphone to provide testimony, to provide context for how they were experiencing the air quality issues, talked about asthma in their household, talked about their own battles with asthma, talked about other respiratory conditions that were now present in their families, in their households, in the buildings in which they lived, among their neighbors. Everyone talked about asthma to a degree that we were frankly astonished. We had not ourselves experienced that, but we did not know the depths of the problem. So when I reached out to Dr. Ford, and I reached out and I said, we clearly have an issue with asthma in our communities. We don't know why. We don't know what's driving it, what's triggering it, but we want to get to the bottom of it. And so Jean said, well, I'm seeing some of that too at the hospital. But my colleagues at the School of Public Health, the Mailman School of Public Health at Columbia, are really looking into this. And why don't I facilitate some dialogue between you and they? And let's see if we can come up with some answers, or at least what are the questions that we should be asking. And so we go up to the Uptown campus, to the School of Public Health, and we meet with Jean and his colleagues, and they were about to undertake a household asthma survey across the Harlem community. They had gotten a grant from the National Institutes of Environmental Health Sciences to look into this asthma issue. And why was that? Because they were seeing an explosive level of hospitalizations, emergency room hospitalizations, regular hospitalizations, pediatric, adult, geriatric, in Harlem Hospital from asthma. And so they realized that something was amiss, and they wanted to get to the bottom of what it was. And so they had applied for this grant to NIEHS, and they were going to look at a part of Harlem that's called Central Harlem. That's really where Harlem Hospital is. It's also the part of Harlem that I grew up in. But we convinced them to include households and census tracts in West Harlem in their household survey, because we were convinced, just based on what we were hearing from our neighbors in these monthly public hearings, that there was also an asthma crisis happening in our part, the western part of the greater Harlem community. And they agreed. And we then began to formulate this partnership with them that would look at what were some of the sources, what were some of the relationships, what was this preponderance of asthma in our community? And this is what they found after conducting the study over a 2-year period. They found that the Harlem community at large had the highest rate and incidence of asthma of any community in the United States. That the incidence and rate of asthma was so high in our community that it drove the entire national average in the United States of America for the incidence of asthma. But what they also found is that we had the highest rate of premature death of any community in the United States from asthma. That knocked us off our feet. It's like, you know, in the back of your mind, you know something is wrong because you hear it from your neighbors on a regular basis, but you had no idea that the depths of the problem was as extraordinary and as damning as it was. And what immediately lifted up for me was that one thing I know, because my mother was a nurse for 43 years, is that when you lose a patient, you are required in the state of New York. In fact, you're required in every state in the United States, but you are especially required in the state of New York to identify what killed the person. What is the cause of death? That must be on their death certificate. So the New York City Department of Health and the New York State Department of Health must know that there is this huge explosion of death from asthma in this particular part of Manhattan of New York City. And surely somebody must be confounded by this and trying to figure out what is going on. But in fact, nobody except for the folks at Harlem Hospital and then their partners at the Mailman School of Public Health were really looking into this. But it was a big secret. And we pulled the covers off this big secret. And what I learned from that is to really pay attention to land use and the relationship between land use and the siting of different kinds of facilities and operations, transportation modes, storage facilities, and the contribution that those land uses will have to air quality. And that has been a piece of work and a body of work that I have done across my career for 34 years. This month, June, is 34 years that I have been working on these issues. And we really bumped into this issue of the relationship between land use and siting of polluting facilities and the deleterious impact that those facilities and that nexus of issues would have on the quality of life, on health, on mortality, on morbidity of a particular population. And it is that experience that really has formed and shaped almost all the work that I have done over these last 34 years, because I recognize that most people are not paying attention to these issues. In fact, I certainly was not paying attention to these issues. And though my work was really all my work and all my motivation for the work that I had intended to do in my life in college, I anticipated that my path was going to be as a civil rights lawyer, as Professor Edelman Lago is, that was where I saw myself, and that was the work that I intended to do. And I had wanted to do that since I was in the 4th grade. But when I came upon this set of issues, I realized that there was another battle within the civil rights arena that very few people were paying attention to, and that maybe this was where I could make a deep contribution. So fast forward to this moment that we're in now, and we see that the very issues that I was looking at, and my colleagues and my neighbors and friends were looking at in 1986, 1987, 1988, were right here, right now, helping to shape and form this COVID experience, this pandemic, and really undergirding, again, we see again, the relationship between the disproportionate exposure to ambient sources of air pollution, particularly particulate pollution, the concentration of high levels of particulate pollution in communities of color, and when those conditions are present, what that means when you get an extraordinary set of circumstances and an extraordinary public health disaster and emergency like coronavirus. What happens when those things come together? And so hence the word syndemic, that now you have pre-existing disproportionate exposures to air pollution. You have a public health emergency like the novel coronavirus. You have those two things coming together to create a syndemic, a level of challenge and public health disaster that is visited upon targeted populations, not because they did anything, but because of where they live and who they are. And so here we are at this moment. So for a minute, when the Centers for Disease Control first released their initial information, disaggregated data along issues of race, we began to see that, wow, there is an enormous level of disproportionate exposure. And I'm just opening up the screen on my tablet so I can read some of this data to you, because it really is extraordinary. And there's another data point that has jumped out for me in this COVID moment, and it is this. So there are 22% of all counties in the United States of America are majority African American in population. I live in one of those counties in Prince George's County, Maryland. The county that I live in Maryland, is the most affluent majority African American population in the United States and probably in the world. These are not poor people. There are some working class sections of the county, but for the most part, these are very, very affluent people, from upper middle class, from middle class to extremely upper middle class. Black people living in gated communities. That's a whole nother conversation for another day. I don't quite understand it as an urban planner, why Black people need to live behind gates, but we do have gated communities here in this community. We have waterfront communities. We have golf course communities. We have every kind of affluent community you can imagine. We have them here in Prince George's County. And yet, we are the COVID epicenter in the state of Maryland. We have 3 times the rate of COVID and 3 times the rate of death from COVID, as does Baltimore City. The only similarity between Baltimore City and Prince George's County, Maryland, is that the populations are majority African American. And that is the end of the similarity. This is a suburban community that used to be a rural community. Almost every subdivision here used to be a farm or a tobacco plantation. Baltimore City is a densely populated city, in my opinion. It's being from New York. It's the only real city in Maryland, in my opinion. The population is so much greater there than it is here, but yet this is the COVID epicenter in Maryland. Still trying to wrap my head around that. So I'm just going to read you some numbers. The global COVID-19 pandemic caused by the SARS coronavirus 2 is ravishing the United States. The CDC reports a total of 2,248,029 cases, with 119,615 people losing their life to the disease. The lack of a strong response to the virus in the early stages of the pandemic has put the Black community in a state of emergency. Black American mortality rates due to the virus is much higher than other groups. At one point in time, 1 in every 1,625 Black Americans had died due to the virus, or 61.6 deaths per 100,000, with a rate 2 to 3 times as high as the rate of whites and Asians, and 2.2 times as high as the rate for Latinos. And here's some new data that just came out in the last week. However, a recent report from the Brookings Institute, indicates that the disparities in mortality for Blacks is much higher than the white mortality rate in every age category. Black people are dying from COVID-19 at roughly the same rate as white people, more than a decade older. More than a decade older. When we dig deeper into the numbers, Blacks aged 45 to 54 have a mortality rate 6 times that of whites. Additionally, we see significant differences in mortality when comparing the crude rate, 2 times that of whites, and the age adjusted rates, 3.6 times that of whites. Why the virus is disproportionately killing Black people, as reported in many outlets, can be linked to structured inequalities, including the lack of access to healthcare, infrastructure, poor housing stock in the Black community, and economic apartheid that has forced many Blacks into working in occupations seen as essential, which increases their risk to exposure to the coronavirus. So the issue is worse than we first expected. Now that we're digging into the data, and why is that? When the CDC first began to share that disaggregated data after people stomped and threatened, mostly people in Congress, that they put out that data that they released was only 57% of all the data collected around incidents of COVID and death from COVID. So the profile was only 57% of the population. This new data from the Brookings Institute represents a more complete picture of all of the data, or at least most of the data that we know of as of this moment. Getting accurate data has been a challenge. Getting accurate data disaggregated for race has been an extraordinary challenge. And so let me pause and say something about some other populations and how they are faring in this moment. The indigenous population, indigenous communities, indigenous tribes, indigenous nations are at the front of the bubble, even more so than African Americans in terms of incidence of COVID and death from COVID. The Navajo Nation has had to close all access to the nation from outsiders because they are dealing with a pandemic that is more intense than that which the city of New York and the state of New York experienced. The Navajo Nation is a much smaller population than is the population of New York State and New York City. But the incidence of COVID is as high there and higher than it was in New York State and New York City, which was the COVID epicenter in the United States. Imagine what they are dealing with. The same is true for the Lakota Sioux Nation in South Dakota. The same is true for many indigenous populations. And what they are facing is not just a pandemic, but indeed a syndemic that includes genocide. So when we talk about this issue, we talk about how we are navigating it as a country, the fact that we are not getting accurate data, the fact that we are not getting the resources that are needed, the fact that the resources that are needed are not being targeted to the population centers and places that are experiencing this pandemic at an extraordinary level is really, really the sin of our moment. And so a lot of us are working on this issue. A lot of us are trying to raise the profile and elevate a narrative that helps people understand that we keep saying that we're all in this together. The hell we are. We are not all in this together. Some of us are experiencing a whole different pandemic than our other parts of the population. And yet we see this debate about we need to reopen. We need to fully re-engage. We need commerce to come back online because economically we're suffering as a country. And here we are once again in a conversation about whether or not the lives of certain people who look like me, are as valuable as the Dow Jones, as how we're trading stocks, as whether or not we have a fully engaged and reopened economy, that our lives are seen as of less value. And we've been here before, but to be here at this moment, when we also are seeing the pandemic of racist violence. Now, let me be clear. The racist violence has been going on since Black folks first showed up in this country and since Europeans first showed up here and encountered indigenous populations. That racist violence has been unending and unyielding. But to see it happening now, in this moment, when people are fighting for their very lives, because probably of exposure to higher levels of air pollution and particulate pollution, and to be experiencing that in this moment of an explosion of racist police violence targeted at African Americans, but also other populations of color as well, and trans people, is almost more than your soul can take. But as many who fight in the civil rights lane, as do I, we have fought many battles. We have seen what looked like insurmountable challenges, but yet we have not yielded. We have taken the resources that we've had and we've made those resources go really far. We've been really creative in our use of law and policy and research and our utilization of mobilization of human capital, people in the streets, to demand that this cannot go on any longer. It cannot go on any longer. We cannot have a footnote on the news. So many people are murdered every day in inexplicable issues of casual interactions with the police and public safety that result in loss of life for people of color. Sometimes they don't even get mentioned on the news. But now we have a new spotlight, a global spotlight, to say this is unacceptable. This cannot go on. And we have to find a new way of addressing issues of public safety, a new way of responding to the totality of the needs of a community, every community. Not some get public safety and some get brutality. Everyone gets what they need. That we send people to respond to moments of crises that are appropriate for that moment. So when we talk about defunding the police, we're really talking about reprogramming how we spend our tax and public dollars. And that also includes how we direct our public health resources to target those who are greatest in need. And that we look at environmental protection through the lens of civil rights and racial justice. That our Constitution tells us that we are all equal before the law. But our reality tells us that that is not now, nor has it ever been true, especially not in the environmental domain. So we're at a nexus and we're at a crux of needing to rethink how we pursue environmental policy, how we pursue environmental enforcement, how we pursue civil rights enforcement, how we look at issues of racial inequality, and how we factor those in to how we provide the resources and the things that people need to be able to thrive in the places where they live. Reducing particulate pollution is a life-saving issue. Just recently, in May, US EPA made a decision that they were not going to change the particulate standard, which actually I was shocked at because I thought they were going to blow up the particulate standard. But in fact, they decided not to. And at first, I thought that was a small victory for our forces, that they didn't just set aside the particulate standard and left it the way it was. And then I was chastised by some of my environmental colleagues who said, That's not the right way to look at it, Vernice, because if they had lowered that particulate standard from 12 micrograms per deciliter, which it is now, to 11 micrograms per deciliter, they would have saved thousands of lives, particularly thousands of lives of people of color who are disproportionately exposed to particulate pollution. So here we are in this moment of utter madness. And what does it require of us? It requires that we not lose our focus, that we dig in deeper and we lean in deeper into how we can deploy the resources that we have to be of support to people who are clearly battling and fighting for their lives. What can we do as civil rights and environmental advocates, attorneys, policy people, public health professionals, organizers on the street who have changed the very debate in our country because they refuse to let us go back to a different moment when this is all acceptable and this is all okay? It's not okay. Black lives do matter. Every life matters. But at this moment, it's a moment to focus on the fact that Black people have not been treated equally before the law, that they're dying disproportionately from police violence, from racism, and from environmental racism. They don't have the public health resources that they need, and their lives are being sacrificed. That's unacceptable. I'm trying to do all that I can to change that narrative. So I think I'm going to open up. We have 15 minutes left, and I think we should have some Q&A now.
Thank you. Thank you for that powerful talk. Black lives do matter, and that is the position that Vermont Law School has taken, and it's so important to hear your powerful words today. We have a few minutes to ask some questions from our audience, and for those of you listening, as a reminder, if you're watching on your website live stream, on the BLS website live stream, if you click on the video, you'll see a chat box on the right side where you can add your question. Or if you're watching on our Facebook live stream, you can add your question to the comment box below. We will try to get to as many questions as possible. So our first question comes from an audience member who says, could you please comment on waste management laws and regulations for better land use? I assume there's a direct correlation between COVID waste, such as masks and gloves, air pollution, and environmental justice.
Wow, what a great question. Wow. And I have to say, I haven't actually thought about this, but we should be thinking about it because the disposition of medical waste oftentimes creates a whole nother environmental threat in terms of that waste stream. I just participated this past Friday, in a retirement ceremony for a woman named Sue Brigham. She was vice president for government relations at Waste Management. She was the single longest continuously serving member of the National Environmental Justice Advisory Council. She served on the NEJAC for 20 years. And Sue brought the whole conversation about environmental injustice and environmental racism into waste management as a company, but into the waste management industry, and got them to take responsibility for the fact that they were a part of the problem in terms of where their facilities were going. But your question is about what are we going to do about this waste stream? I don't know the exact answer to the question, but I know that it is a new and unique waste stream. How it gets treated, how that waste gets transported, where it gets ultimately deposited. Are we going to talk about incinerating it, which will then restart a conversation about incineration? All of those issues are on the table, and they need to be looked at uniquely because this is a unique waste stream, as is the waste stream for medical waste, which used to be oftentimes commingled with sanitary waste landfills, which created public health challenges for the populations of folks who live near those landfills. This is a really excellent question that I have actually not heard too many people raise up, but it really needs some serious attention and maybe a unique approach from the waste management industry and how they collect, transport, store, dispose of this waste stream. I know that's not a complete answer to your question, but whoever asked this question, I want to lift you up for asking it, because it's yet another dimension of where we are in this battle with this pandemic. What do we do with the waste?
Great, thank you. Next question. As someone who works in the energy justice field, what are environmental justice policies dealing with COVID that I can advocate for beyond utility moratoriums?
Well, the air quality issue, the enforcement of the particulate standard by energy companies, by those who are emitting particulate pollution, the National Ambient Air Quality Standards, hazardous air quality standards, that there's a real need to do the most stringent and employ the best available control technologies on all of their facilities now. We have been battling via EPA for decades about whether or not the fossil fuel industry and the chemical manufacturing industry and other energy facilities will in fact employ the best available control technologies. There are standards within the Clean Air Act that require that you have to. In this administration, we've actually let those standards slip, and we've elongated the period of time that the energy sector has to install those best available control technologies. We do not have the luxury to have this debate anymore, because we now know that COVID is moving through the air, attaching itself to air pollution particles. That's one of the ways that COVID is being dispersed around the globe and around our country. Therefore, the energy sector has to step up. Don't negotiate the conversation. Don't elongate the conversation about whether or not you're going to spend the money. Every dime you spend on installing best available control technologies is going to save lives, especially the lives of people who live in close proximity to your facility. So now you can't recede into the background. You have to step into the foreground and say, as a sector, this is what we're going to do to make sure that we are being as protective as possible of human health and the environment. That's what I think about the energy sector and what they can do.
Thank you. This will probably be our last question. What do you think that the racial inequalities laid bare by this endemic will lead to in terms of policy or legal changes? And if so, what changes would you like to see?
Well, I think one thing that's certainly going to happen, and I'm going to say this without qualification. If you think environmental policy is important, if you think public health protections are important, if you think that spending our federal resources, our state resources, our local government resources in the ways that are most protective of human health and the environment are protective for you and your family, then you better vote like your life depends on it. And you better drag everybody you know, and you better get everybody you know to be registered and to participate in this process. Yes, there's going to be massive voter challenges that are going to happen in November. Yes, people are going to stand on long lines. Stand on the line. Bring other people and bring snacks, because you're going to be out there for a really long time. We must change who is in control of federal policy, of governance. The CDC has almost been turned into a laughingstock. We don't know what's going to happen in terms of the production of a vaccine to make our populace safe, but we know that the seriousness that this moment requires is not being given from our national government. And so what can we do about that? We can gripe, we can bitch, we can demonstrate, and I think demonstrating is important, or we can change the people who are making and not enforcing the law. That is the public health imperative of our moment. More so than a political imperative, it's a public health imperative. And it's connected to our engagement in our political process and our speaking our collective voice and taking some control over what happens in our communities. That's what we have to do. That's what I expect. I expect that people are going to turn out in record numbers. I do. I expect that people who might have been a little confused in 2016 are going to be a lot clearer in 2020. Because if they're not, your life and my life is hanging in the balance. I love my house. I love my neighborhood. I love my county. Normally, I'm sitting out on the deck with the birds chirping and the bees trying to get me. And that's a great thing. But one day, I'd like to leave my freaking neighborhood and go back to my office and see my friends and see Professor Edelman Lago again. We're doing a lot of work. We haven't seen each other in months. And it might be a year before we see each other again. This is unacceptable. And it's unacceptable because people have decided to play Russian roulette with our lives. I don't know of any more stringent, extraordinary, overarching imperative than this to get us all up out our seats and to do everything that we can do to change the political leadership and the political landscape in our country. And you young folk, there's more of you than there are people in my age group. No sitting it out. Maybe some green group candidate will emerge. Put them in a box. This ain't the time for that. This is the time to stand together. And this is the time to speak up. And this is the time for you to assume the level of leadership that is required of you as your generation. This is your moment. You're out in the streets now. Take it to the ballot box and stand on that line with snacks as long as you need to, because we're going to be out there for a long time. And of course, vote early where that's possible. That's what I think.
I can't think of a better note to end on, so we're going to leave it there. Thank you, Vernice, for such a powerful talk. Our next Hot Topics talk for our audience members will take place on June 25th, just in a couple days, and we hope you can join us then. Thanks so much, everyone.
Thank you, Hot Topics audience. Thank you, VLS.